On today's 2 on Your Side Town Hall, the vast majority of people are still waiting to get vaccinated, but some big steps forward today. We're going to walk you through the changes with a great live guest who will join us.
Plus another local connection to the effort to eventually get millions of kids their COVID shots.
And then at the end of the half hour, major changes to this year's NFL draft. It'll just be about 3 hours away from Buffalo, and Bills fans, if you want, you will be able to experience some of it in person.
We will get to all of that, but first, there has been a lot of vaccine news today, and we want to take some time here at 5:30 to help you make sense of all of it, including the big news that all New Yorkers 50 and older will soon be eligible for a shot. Good evening, everybody. I'm Kate Welshofer.
And I'm Michael Wooten. In a moment, we're going to be speaking live with the local doctor who is helping run the planning for vaccine distribution in our region. We also want to ask her about the announcement today from AstraZeneca. You've probably seen this, the possibility of putting a fourth vaccine in the mix.
So here are the headlines. AstraZeneca says its vaccine is 79% effective at preventing symptomatic disease, better than Johnson & Johnson, not quite as effective as our first two approved shots from Moderna and Pfizer. But we should point out they are all 100% effective at preventing COVID-related hospitalization and death.
Like the first two, AstraZeneca requires 2 shots spaced out over a few weeks. J&J is still the only approved vaccine that just needs 1 dose.
But like Johnson & Johnson, this new vaccine from AstraZeneca does not require super cold storage, making it easier to administer.
Yeah, so the bottom line here is that the potential fourth vaccine is now on the horizon. AstraZeneca is cheaper to produce, it's very effective, and it could get emergency use authorization in less than a month's time. Let's talk about that and a whole lot more now with Dr. Nancy Nielsen. She is in charge of planning the vaccine distribution for this region and also Senior Associate Dean for Health Policy at UB's Medical School. Great to see you again, Dr. Nielsen.
Hi, Michael. How are you?
Doing great.
It's great to have you back. We want to start, Dr. Nielsen, with the AstraZeneca vaccine. So far, we just have a press release. So everybody really wants to see some actual data, but it seems that the blood clot concern wasn't really an issue after all. We'll ask you to begin with, would you take that vaccine?
Oh, sure. Absolutely. I mean, if you think about it, I mean, you said it exactly right, Kate, when you summarized it at the top of the program. It is completely 100% effective in preventing hospitalization and death. So you bet I would take it.
Yeah, that really is the key that sometimes I think, Dr. Nielsen, gets lost in all the conversation about, the efficacy of these vaccines. Something 60%, it's 70%, it's 90%, right. But they are all at this point completely effective at keeping you out of the hospital and keeping you and 100% effective at keeping you alive. That is so important. The big news in New York State today was, of course, that starting at 8 o'clock tomorrow morning, any New Yorker 50 and older can sign up to get a vaccine. The governor says that he made that move because the state's allotment is apparently going to double from 400,000 doses to 800,000 doses a week. But of course, that isn't going to happen overnight. I wonder if you worry that we're expanding eligibility, we're going to put more people in this pool, and maybe we don't have all of those available doses just yet. Obviously, that can lead to frustration for people.
Well, I'd rather have people know they're at least eligible than not be eligible. But you're right, it doesn't create any more vaccine when you announce that you've expanded the eligibility pool. We're working hard to try to get a mechanism to help people find slots available. More to come on that. Give me a couple of days, but UB's on this one.
And as far as the local distribution goes, you usually learn what we can expect over the weekend. So how does this week look for Western New York as far as getting vaccine here?
It looks real good, Kate. It's actually not a lot more than we got last week. It's about the same, but it's a different distribution. For the very first time, some physicians' offices have gotten vaccine. Not a lot, but a few, and so that's great news, absolutely great news. The other thing that is good news is the county health departments are getting a lot of vaccine. So we have the 2 mass vaccination sites, one at UB and one at Niagara Falls, and we'll be getting some more vaccine to try to help Allegheny County catch up because they've been lacking vaccine, and we really needed to get it to Allegheny.
Dr. Nielsen, before I move on to the next question, if I can just follow up on that briefly, we were kind of under the impression that doctors' offices weren't getting these vaccines. And I know some primary care doctors have said, who has a better relationship with patients than us? Let us kind of maybe convince some people that they should take these shots. So doctors' offices are able to administer these vaccines, and some of them are getting them.
Oh, for the first time, Michael, and I've led the parade saying, let's get it to doctors' offices. So this is the very first week that any allocation is going to come to physicians' offices, and we're thrilled. We're thrilled.
That is really great news. Erie County has really jumped up above the state average in terms of the percentage of people who've gotten at least one dose of vaccine. But besides Chautauqua County, our other counties are still below average. You just mentioned Allegheny County. I wonder if you can elaborate a little bit more on the plan. I mean, is it just that more doses need to be sent to these areas, or do you think that maybe there are larger populations in some parts of our region that are choosing maybe not to sign up, or they're having more difficulty signing up?
Well, if you really want to know what I think it's because people who can travel to get vaccine are doing just that. They're savvy, they're mobile, and so they get in the car, they drive to a mass vax site in Potsdam or Syracuse or Olean, as we had a week or so ago. So this big dose aliquot is going to Allegheny this week. What we're hoping is that it can somehow be restricted to people living in that area. So we really do not want people from Erie County to drive down there. I mean, it's frankly just not fair. So it's hard to restrict that in the state sites. They don't have any mechanism for doing it. So Allegheny is working very hard to make sure their residents at least have first dibs on the appointments.
We got a question sent to our text line that we wanted to ask you as well. The viewer said, I received my first vaccine on March 6th, just tested positive for COVID. Can I still take my second Pfizer shot, which is scheduled for next Saturday, March 27th? So how would you answer this particular situation?
So I have to calculate this, Kate, because when you test positive, you're supposed to isolate for 10 days. And if the person is asymptomatic and beyond 10 days, then they can get the vaccine, the second vaccine. It does not cause any trouble to take it then. And since the person already has a second dose reserved, they can go ahead and get it. But if they're still in the isolation period, they should not come out of isolation to go get the second dose.
Such a simple and great explanation there. We encourage people, if you have questions, you can always text us or email us, and we try to answer as many of those as possible. Dr. Nielsen, we have just a little bit of time left. I wonder if you can elaborate a little bit more on what I mentioned a moment ago, that the governor says our vaccine allotment from the federal government is going to double in the coming weeks. How are you planning right now to, have a plan here in Western New York to get those available doses out?
Oh, we can do that. The local health departments have an incredible plan that they've had in place for years to do mass vaccination. They're not at capacity right now. We're going to be able to absorb this between that, the pharmacies, the docs. It's a wonderful situation, and we're hoping that, in fact, the governor is absolutely right.
We've been chatting with Dr. Nancy Nielsen, a senior associate dean at UB's medical school, also in charge of planning the vaccine distribution for our region, and such a great resource for us. Dr. Nielsen, thanks again for being here.
Thank you both.
Yeah, it's really great to see you.
And coming up on the town hall tonight, new insight into why kids are less likely to get really sick from COVID, and how an upcoming child vaccine trial has a location pretty close by.
Yeah, as we go to break, did you see who made it on HBO's Last Week Tonight with John Oliver last night? Yeah, look at that. It's a recently vaccinated Totes McGoats, the recycling mascot in Niagara Falls. We would play audio from this clip, but there is some adult language, Kate.
Uh-oh. The comedy show also played part of a story our Dave McKinley did on Totes during the lengthy segment about plastic recycling.
It's pretty funny if you're an adult. Totes with the vaccine.
We're close.
Stay with us, everybody. The town hall returns after this.